Hi, I'm Sarah, and today I'm going to be showing you how to do subcutaneous injections at home yourself. This can also be called sub-Q. Pretty much it's just medicine that's going to be injected into your fat. The main medications that we use here in our clinic that can be subcutaneous is Depo-Provera, estradiol, and testosterone. If you are watching this and using any other medication, it's still going to be administered the same way. These are just the top 3 that we use here in our clinic. So first, you'll want to make sure that your whole area is clean that you're going to be using, so that way your things don't get contaminated along with your hands. I also recommend that you have any itches, go ahead and scratch them, and then also make sure your hair's out of your face and not gonna so you don't be tempted to touch it. And if you have sleeves, go ahead and just roll them up so they don't possibly fall down and get on your hands. And now that you've done that, you need to then wash your hands either at the sink with soap and water, or you can use hand sanitizer, which is what I'm going to do today. So I'm going to go ahead and clean my hands. Now what I like to do first is actually set up everything in the order that I'm going to use it. So that way it's all organized and I'm just ready to go and I don't have to think that much about it, and it's just almost like a ritual. So first we're going to need alcohol swabs, and then you're going to need your syringe and a bigger needle. Our clinic prescribes a bigger needle to draw up the medication because it makes life easier, especially for the testosterone, because that is a thicker consistency than some of the other medications, and so it can be a lot trickier to draw up yourself. And then we'll give you a smaller needle to administer it. And then of course you'll want a Band-Aid and your medication. I am using normal saline, so it's going to be very easy for me to draw up. Like I said, testosterone's difficult. It's in an oil, but you, with practice and time and patience, you will get a lot used to it and a lot better at it and used to it, and it won't be a problem. And then as for like Depo-Provera, that kind of looks like a milky white color as opposed to clear. So the medicines might look different, and the consistency might be different. Since mine is a very liquidy thing, it's going to be quite easy for me to use. So if this is a brand new vial, it would have a cap on here that you would just want to snap off. And then after that, it's not going to go back on. So you're going to have to use an alcohol swab to clean the top of that before you're going to use it. So we're going to go ahead and open up the alcohol swab. And you're going to want to clean this for at least 30 seconds. I'm not going to do this for a full 30 seconds because it's a brand new bottle, and you don't want to watch me do that for 30 seconds. And you're going to let that dry. And then after that, I usually tell you guys to just go ahead and clean your thigh, or whatever location you're going to be administering it. So that way, by the time you're done drawing up the medication, that area is dry and you're not going to have any stinging or burning from the fresh alcohol going into the wounds. So for subcutaneous injections, you can do it on the top of the thigh. You can do it on the side of your stomach, and you just pinch right here and you can put it in there. And those are the main 2, because the other one would be back here and that's too hard for you to do on your own. So yeah, the top of the thigh or your stomach right here. So you'll just want to clean an area. And I always recommend that when you're doing this, don't go back and forth, because that's just going to be rubbing the dirt all around. What you're going to want to do is start in the center and spiral out, which I will show you. And then also to clean a big enough area so that you're not going to miss that clean area when you go to inject it. So let's bring you down here, and you can see my leg, and I'm just going to start right here in the center, and I'm going to spiral out until pretty much the whole top of my thigh is clean. And then you can go ahead and open your syringe. They usually make it easy, and they'll put arrows at the top of it, but if not, it's also kind of a given, because on the other side there's not really a whole lot to to grab to actually be able to open it, whereas up here, there is a lot. So you're gonna go ahead and open this up. It's gonna open up plunger first. So that way you're not touching this area. If you do, well, you don't want to touch it. You don't want to touch any part of this because that's going to be touching your needle, and it can then contaminate your medicine and then obviously contaminate you. So you're going to keep that in here until you need it, so that way it stays clean, but it's open for you and it's going to be easy for you to take out. And then you're going to get the big needle. I'm using the 23 gauge 1-inch needle, and you're going to open that. Pharmacies have different size needles on hand, so you might not have the same needle size as me, but again, basic concept: big needle, draw up, little needle, administer. So now that you have this open, make sure you don't touch this part, because again, you would then be getting bacteria in that hole, which leads into the needle, and you just don't want that. You're gonna take your syringe out, and it's gonna go in between those two circles, and you're just gonna spin it a tiny bit. It will not let you go much further, and that's how you know it's on. If you guys have one of these guys, you can go ahead and bring that down so it's out of the way. If not, then don't worry about it. And what I'm gonna have you do is I'm gonna have you pull up air. Now, if you're administering testosterone, you can pull up like a decent amount of air because the extra pressure in the vial is gonna only make it easier. But if you're drawing up something like Depo-Provera or estradiol, if it's not like a thick, if anything that's not a thick liquid, I would only draw up what the amount that you're gonna draw up, because this is so liquidy. If you put too much pressure in here, it will be too much pressure and it's just gonna kind of like leak out and maybe cause some issues. But for testosterone, I tell people you can draw up like a little bit and they're like more than what you're gonna do, because usually our testosterone doses start out at like 0.2, which is like that. It's nothing. So if you just pull up like this, it'll make testosterone a little bit easier for you. Now when it comes to measuring, I'm using a 3 milliliter syringe right now, and you can see, maybe if I turn this slide away, that will be better. Yeah. This first line is actually 0. And then these little lines are 0.1. So we have 0.1, 0.2, 0.3, 0.4, and this is 0.5, or half of a mil. And you can see you have half, 1, 1.5, 2, 2.5, and 3. You might be using a 1 mil syringe where it's only gonna have this much, and that would be just a really skinnier, longer needle or longer syringe. But either way, you have the same concept of how they measure it out on here, and so therefore you know where you want your medication, how much medication you want. If it's Depo-Provera, you're pretty much going to be taking up all of the medicine in that vial. So I'm just gonna give myself, let's do 0.2 because I don't really need normal saline. So I'm gonna draw up to the 0.2 line. You can maybe see that. Also, you're gonna want to measure what I say the top of the hill right here, because you can see my my syringe has like a hump in it, and so I tell people to measure at the bottom of the hill and not at the top of the hill, if that makes sense. So you're gonna want to line up that bottom part to there. So you can see that line is at the 0.2, but not the top of that hill. So that way you're getting all the medication that you need. Now, you can go ahead and take this cap off. And you're gonna go ahead and stick it in the soft part of the vial, obviously. Doesn't really matter where. You're gonna put that air in there, tip it upside down so let gravity help you out. Then you're gonna go ahead and pull up the medicine that you need. Now, if it's testosterone, like I said, it's gonna be a little bit more difficult. You don't have to just pull back to where you need to measure. You can pull back as far down, as long as you don't pull this whole thing out. So I usually tell you not to go past the 3 here. You can pull down and watch the testosterone slowly drip in there. And then once you think that there is the right amount, go ahead and flick all those air bubbles up, or you can take a pin and tap it if it hurts your fingers. And then you can go ahead and push whatever medicine's in there up here into the vial and get all the medicine that you need. So I got mine, and you can see I've used this a couple times. So if you're seeing like these bubbles coming out, it's just the medicine because I've used this a couple times. So there's pressure in here. So you take your needle out, make sure your vial's upright and you're taking it out, because if not, your medicine can leak out. Now, when it comes to recapping, if you don't have one of these to lock in place to keep that needle safe from stabbing you, you're gonna want to take your lid and you wanna make sure you go in slow and straight, because this needle can puncture the lid if you go in at an angle, and then it can poke your finger. And then you also wanna make sure you don't put any fingers right here, because if you put it on too hard, it can crack the lid and go in further and then poke your finger again. So now you can see that I have all my medicine and I need to now switch my needles. If you touch your face or your hair, that's fine. You can then just re-sanitize or re-wash your hands. But while I'm doing that, so there is air that you need to suck up, because in your needle there's medication in there still, because it's not just in here, it's all through here. So you're gonna want to pull back on the plunger until you have air, and then that's when you know that it's safe to discard this needle. But before you take it off, because you don't have anywhere safe to lay this down, keep the needle on here, place it down on the desk, and take your little needle. You're gonna go ahead and get that open and ready for you. So you do that, and then you can place it back down on your desk. Get your syringe and your needle, take it off, grab your other needle, and go ahead and put that on just like you did the other one. And then by doing that, you might have some air bubbles at the bottom, so you'll just want to flick it a little bit to get the air up there. If some of the medicine comes up here, it's not that big of a deal, because it will join the medicine eventually. Air weighs less than the medicine, so it's always going to push the air out before the medicine until there's no air left in there. Now there's 2 ways that you can get all this air out. One is obviously you just push it up to where you the amount of medicine that you need. So I know I need 0.2, so I can push my plunger until this part is at the 0.2. Or you can also take your lid off and you can just push until you see that. Again, my medicine is incredibly thin and like pretty much water, so yours won't do that until there's no air. Mine's just special medicine because it's not really medicine. So you'll just keep pushing it up slowly. And once you see that, you know you're good. And you can even double check by making sure that your plunger is where it needs to be. Of course, it struggles to focus on this, but it's at the 0.2 line. And now you are good to administer the medication. And as you can see, it's a very short needle, so it's just going to be going into your fat. So I'm going to move you down here again so you can see my thigh. And for this, I'm going to have you make sure your leg's relaxed, and you're going to want to pinch your thigh to bring all that fat up there, and you're just going to go in like a dart. And then you're going to administer that medication slowly, and then you're going to unpinch, and then you can take the needle out. Now I tell you to unpinch first, so that way you don't accidentally kind of milk some of that medication out. And And then also you just can kind of go in straight. Some places will tell you to go in at a 45-degree angle for subcutaneous injections. Our needle is very short. It's 5/8 or a 1/2 inch. So it's not gonna ever really hit your muscle unless you're teeny, 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 tiny. Now, if your clinic for some reason doesn't give you the small needles, then yes, you might need to go in at an angle, and I would talk to them about that. But for us, we use teeny tiny needles, and you just pinch and you can just put it all in there. The testosterone is, again, for the 100th time, thick. So if you have to poke it into your skin, unpinch, and then hold this plunger still to be able to put more pressure on this plunger to get the medicine all in you, that's fine too. You don't have to keep pinching while you're giving the medication. We just have you pinch because it brings the fat up to the top, and a lot of times that pinch will take away from some of the pain of the needle. And then again, unpinch before you take it out so you don't milk that medication out. Now, after that, you'll then want to, if you have some blood that you want to blot off with some gauze, that's fine, or you just put a Band-Aid on it. I'm not really bleeding, so I'm not going to bother doing anything right now, which is also normal. You can have blood, no blood, a little bit more blood than usual. Every single time is going to be different. So, getting rid of these, you're going to want to make sure that you put these in something like a milk jug or a laundry detergent jug, because it has like that hard plastic, and you can just go ahead and put these in there, and then that way the needles aren't going to accidentally like poke out and then poke somebody. It's important that you also store that jug up high somewhere so no children can get to it, and then once it's full, you can bring it to your provider's office and they can dispose of it properly for you. And then that way, nobody's going to accidentally get poked by a needle or anything. So yeah, that's how you administer subcutaneous injections. I hope you learned something and enjoyed this, and have a good day.